I'm sorry to interrupt. I just need to remind everybody that this is being recorded.
Empathy. That's actually very good because we do have a lot of empathy for our patients. We'll talk a little more about that later. Very good. Trustworthy and skills. Very good. I think that you're on the right track, and it does take all of this to be a nurse. I'm going to move on from this, and I appreciate all of your answers. I really like that what you're thinking, because a lot of what I'm going to tell you about is encompasses all of these qualities. So let's compare your answers with what others say that a good nurse should have. So a caring nature, they should be empathetic, which means they identify, understand, and share other people's feelings, and they're adaptable. They are definitely detail-oriented. They have to understand and know a lot of information, so typically they write a lot down. They're organized. They definitely have to be good communicators. They talk to patients, they talk to physicians, and they need to know how to communicate the patient's needs. They're a quick thinker, they have good judgment, they're hardworking, and they have physical and mental endurance because they're typically on their feet quite a bit, and they have a lot of equipment that they might move around as they care for their patients. So those qualities that make a good nurse are important because nurses touch people's lives every day. And even if the patients can't remember the nurse's name, they remember how that nurse took care of them and how that nurse may have made them feel at ease and feel better. So nurses work in a variety of settings. They work in hospitals, doctors' offices, schools, and so on. They work in a variety of specialties as well. So in the hospital, they may work in pediatrics or labor and delivery. They may work in surgery. They might work in the ER. And then they also might have administrative roles, like as a manager or an administrator, or even our chief nursing officer. And in the community, they may work as a school nurse or a home health nurse, or even as an advanced practice nurse, such as a nurse practitioner. So how is nursing different from other medical careers? Nurses care for the whole patient. They use a holistic approach, which means they not only consider the patient's medical condition, but they consider psychological, intellectual, emotional, spiritual, or other social factors. For example, they would consider whether or not their patient understands their illness. Do they need more information or more education? Can they read? We give our patients a lot of information, and not everyone can read. And so that is important to consider if you have to give education to your patient. Do they have other limitations like dementia or Alzheimer's that might impact their care? Do they have religious needs to consider? Do they just need someone to sit and hold their hand because they're highly anxious and have fears about what's happening with them? Do they need a support system? Do they need transportation so they can get to the doctor? Can they afford their medications? So these are all things nurses think about in addition to the patient's illness to help find solutions and aid their patients in their care. So for this reason, nurses are well known to be strong advocates for their patients. Nurses are dedicated individuals who work with the most vulnerable populations, so our elderly, our babies, and our very ill. The caring and compassionate qualities of nurses set them apart from other professionals, and we know this is true because every year there's a Gallup poll. And this year's Gallup poll found that 85% of Americans rate the honesty and ethics of nurses highest among all professions. So in fact, nurses have been rated as the most trusted professional for the past 18 years. So Americans definitely trust our nurses. So you might ask, how do you become a registered nurse? So first you need to attend and graduate from a nursing program offered at either a 2-year or a 4-year college. So here on the Eastern Shore, local colleges would be Chesapeake College, which would give you the 2-year degree, and Salisbury University if you wanted a 4-year degree. But there are many different colleges out there. They're both online, and there's many, many in Maryland. So next, after you go to college, you need to pass the National Nursing Exam, also called the NCLEX. And then once you pass that, you can obtain your state license to work as a nurse. And then from there, the possibilities are endless. So once you're done with nursing school, naturally the next question is, are there nursing jobs available? And where will I work? So everyone that goes to college, ultimately you want to be able to get a job in what you went to school for. So obviously it will be a few years before you are ready to start work as a nurse. And since you still need to go to college, you're looking at what, another 4 to 6 years. So how many nursing jobs do you think will be available over the next decade for when you are done college and ready to look for a job? So this is going to be our third polling question. So how many nursing jobs across the United States do you think will be available over the next decade? You can use your cell phone or the computer. Anybody else? Any other thoughts? I'll give you a few minutes to kind of sort it out. Okay, well, those that pick 300,000, you're actually on the right track. So according to the Bureau of Labor Statistics, the nursing profession is expected to expand by approximately 12% between 2018 and 2028. That means they expect as many as 371,500 jobs for nurses over the next decade. So that is a very high employment potential for anyone that wants to be a nurse. So don't worry that the jobs won't be there, because they're going to be there. So then you might think to yourself, can I do this? Can I really do this? And my answer to you is, you absolutely can. As I've told my own children, you can do anything you put your mind and your heart to. As long as you have the drive and the determination, you can definitely do it. So for those of you that are considering a job in nursing and you really think that you have the qualities, definitely go for it. You can do it. I have a few questions for you to think about, which only you can answer. So no poll question for these. Just think about, who inspires you? What are your passions and interests that draw you? What qualities do you have that define who you are and what you want to do with your life? And do you want to use your strengths and qualities to help others in need? These are all questions that you should consider as you start to think about what you want to do with your life after you're done high school and going on to college. Okay, I'm going to share with you a short video from Johnson & Johnson. It's about why nurses love their jobs. And as I mentioned earlier, the nurses have both heart and mind. So as you watch this video, think about how these nurses portray their heart and mind. Give it a minute. Okay, should start.
We're more than just given medications. We're more than just given care. We actually give support to people who sometimes feel like they have none, and you are an ear for them to be able to speak to.
Once you start taking care of the patient over and over again, and you're there for like 12 hours out of a whole day, you get to know them. You get to know the little things that make someone who they are. What kind of food do they like to eat? What kind of music do they like to listen to? What is their favorite movie? And just being there at their bedside and listening to them and talking to them, it's not just about the vital signs.
That look on that patient's face when they go from being terrified to just being grateful. They're just so happy and gracious when, you know, you kind of walk them through something that wasn't expected.
Working at a children's hospital, it's like going to an amusement park every day. It's just, you know, there's children's movies and cartoons on in every patient's rooms, and it's really difficult to have a hard day just because you're working with probably the happiest and the funnest population.
I love that every day is different. I see different patients, I see different diagnoses, I see different outcomes. I love that I'm meeting new people, but I'm not just meeting them, I'm taking care of them, and I'm many times helping them get better and go home to be with their families and live the rest of their lives.
In my practice, I work with primarily low-income women, a lot of teenage moms, and I really feel like sometimes it's the first time that they've really had somebody who wanted to teach them about things and took the time to listen to them.
That helps people in ways that medication can't sometimes. That's the support that a lot of people need, just on a human level.
Okay, so just something to think about. Nurses do a lot of things, and I think that if you were interested in a job in nursing, going forward, I think that there's a lot that you can offer your patients. So if you're interested in more information on becoming a nurse, here's a couple of links, and I can share these with Ms. Bell as well. But Johnson & Johnson has a wonderful website that talks about nursing, and it has videos on there. It has brochures you can print. It has a lot of information. The American Nurses Association is our national association for nursing, and they also have a website. If you go to this link, it'll take you right to their web page that talks about what nursing is. And then also don't forget to talk about this with your counselors at your high school, or you can also visit your college that you're interested, or call them. I would set something up with everything being virtual now, but you should be able to speak with an advisor and they can give you more information on it as well. Or if you know someone who's a nurse, talk to them. There's multiple ways you can do it. And I'll give you these links to Ms. Bell, and then she can forward them to you. So I leave you with this thought. Consider how you can touch other people's lives one day by becoming a nurse. So be a nurse and be the change you want to see in the world. Does anyone have any questions?
Now would be a great time to unmute your mics and you can ask questions. If you're uncomfortable doing that, you can also put them in the chat and I would be happy to share it.
Now I'm trying to.
Oh, come on. I'm sure somebody has something they can ask about becoming a nurse. Somebody would like to know, what is a midwife?
A midwife is a nurse that works with women who are having children. So she's much like a GYN, where she can help you to have your baby. Midwives also work with OBGYNs as well in the hospital setting and in the clinic setting.
Jenna, go ahead and unmute your mic.
Okay, so like when you nurse for a different field, like if I were to nurse with a OBGYN, like you just said, would that take a different toll on schooling? Like, would I have to take more schooling depending on where I work, or is it the same all around?
To be a nurse midwife? Well,
Like,
go ahead.
like just an example, because like the different nurses for different fields, do they all have the same amount of time in school, or is it different?
Well, your basic nursing education is the same. So you would go to whatever college that you select that has a nursing program, and you have to complete a nursing program. So there's 2-year programs and there's 4-year programs. Once you complete the program, then you would take your nursing test, which is a national test, and then you can get your license. Then once you start working as a nurse, you will specialize. So you might get hired. So let's say, for example, you really want to be a nurse midwife. That would be a good example. But when you're hired to the hospital, you can't start as a nurse midwife because that's considered an advanced practice nurse. So you are a registered nurse at this point. So you work a couple of years either in a med-surg unit, or you can make your way to, say, a labor and delivery unit, and you can work in a mother-baby setting, and then go back to school and you'll get your master's degree, and then you can even get your doctorate in advanced practice, depending on the school, and then you can become a nurse midwife. And once you're done that school, there's another test. You would take what's called a certification test. And once you take that test, then you can qualify to become a nurse midwife, and then you would look for a job in that role. So there are steps to it. Your basic start is to become a registered nurse, and then from there some people know what they want to do, and some people really aren't sure. So it's good to start as a registered nurse and really get a feel for what other different specialties there are. Because as a registered nurse, you can work in critical care, you can work in the emergency room, you can work in pediatrics and labor and delivery. You're not the one delivering the babies, but you are there helping that mother through all of that. So you can do a lot as a registered nurse as well. And then advanced practice takes you to another level where you're more of a provider of care. Does that answer your question?
We had, I think these all can be tied together. Can I be a nurse in any department? Do nurses get to help with surgeries? And somebody's interested in an annual salary of a nurse.
Oh. Well, yes, you can do all of those different specialties as a nurse. And yes, you can definitely help in surgery. I'm the surgical educator here at Shore Regional Health. And as a nurse in surgery, you can be in the operating room. You can even learn to be scrubbed in and right side by side with the doctor. And there's different roles within the operating room that will allow you to do that. And a salary, I don't know what the starting salary is now, but I know that I feel like I'm not sure. If I say it, then I'll be wrong. But it's a good salary. I know that. What you could do is you can Google Salary Monster and I think what that does is it takes the average salary of any profession and it'll give you a rounded number of what the average salary is for your area. So if you put in at salarymonster.com and then you put in Maryland and whatever, you could put your zip code, it'll give you the average salary of nurses in this area. I hope that helps.
I have one more question. This question is asking, and I believe they're trying to say neonatologist. They would like to know if a neonatologist was going to be present if somebody is giving birth.
Not normally a neonatologist. Normally it's your OB/GYN who's there when the baby is giving birth. A neonatologist is someone it's a doctor who specializes in premature babies. And so they work in a different setting.
Does that help, Rochelle? She said yes.
Okay.
One last question. Are there any challenges that nurses face?
Oh, wow. So I have to say there's many challenges that nurses face, and they're in many different ways. There's always technology changing, so you're always challenged with a new thing, whether it's a computer system that now you're doing your documentation on, to equipment. Some of the equipment can be very high tech. Other challenges could be just inpatient care, and it depends on your role as a nurse, but even in the most happy settings, like in the video, the one nurse was a pediatric nurse, and he said he works with some of the happiest patients, and that's true. But the challenge is they're in the hospital because they're ill. And so sometimes it's very hard to see our very young children and babies become very, very ill. And sometimes there are bad outcomes, and that can be very hard on nurses because we're all humans. So we will cry with our patients when sad things happen. So, and the challenge is that you can't lose your composure. It's okay to cry. There's nothing wrong with that. And I think our patients see us as human when we do, but you can't lose your composure because you're still the professional. So you need to be able to walk away, take a breath, and then come back and keep caring for that patient. So there's many different kinds of challenges, but most of the time we find no matter what the challenge is, most nurses walk away and they will still say that they feel like they have an extremely rewarding job. Does that help?
I'm sure it does. Claudia, I'd like to thank you very, very much for your time today. It was very informative, and I love the polls that you had that the people could interact with you. Very nice.
Good, thank you. I'm trying to figure out how to make my screen reappear.
If you go to the same thing that you went to, there you go.
There we go. Okay, wonderful. Okay.
So Janine, would you like to introduce our next two guests? You're muted.
Sorry, I was muted. So Dr. Kratom is one of our neurosurgeons. He is a fantastic doctor, came from Northern Virginia. And he's there with Wendy Towers, who is a nurse, got our nurse practitioner. And they are an awesome, I guess we could call them the dynamic duo, because they take care of many patients. A lot of them, before they came to the Eastern Shore, we would have to send them out somewhere. And with them being here, we're able to save a lot of patients quickly. So turn it over to them. So Dr. Kratom and Wendy Towers.
Thank you for being with us.
Thank you. Good morning.
Thank you. Good morning.
Can you guys hear us?
Yeah.
So that was a tough introduction. I'm going to disappoint you, I'm sure, this morning with all that introduction. So rather than talking about different slides, you know, I have so many cool things to share as far as videos and slides and pictures, but I didn't feel like, you know, previously when I did these platforms of videos and pictures, it didn't translate so well. So I rather just keep an open discussion and answer questions and keep it informal than make a PowerPoint and make it into a formal presentation that people have a hard time following. Was that okay with you guys?
So if they're going to have a discussion, we may want to unmute our mics so that we can actually answer and converse.
Yeah, maybe everybody can unmute their mics and ask away, and we'll try to answer.
Do you think you can start by giving them a little bit of background of what you do so they can have a starting point to ask questions?
When do you want to start?
Sure. I'm Wendy Towers. I'm a nurse practitioner. And one of the things that you'll notice with nurse practitioner is nurse. So I was a nurse for many years and went back to school actually later in life to become a nurse practitioner. Some people go to school right away and they continue getting their master's or doctorate degree and not practice nursing the degree that I practice nursing. So one of the things when you start thinking about careers is how long do you want to go back to school, or how long do you want your schooling to be? Do you need to start working right away, or are you able to continue through education right along? One of the things to think about if you're really interested in becoming a nurse practitioner is that you really should get some experience as a nurse, mainly because a lot of programs won't accept you into their program without some sort of nursing background for at least two to 3 years, because they want you to have some in-depth knowledge of patient care before you become a nurse practitioner. I work in collaboration with Dr. Kurtam, and one of the great things about being a nurse practitioner with a surgeon is that I also get to work in the operating room, which is where I worked for many years beforehand. So I had a lot of knowledge about surgery prior to joining Dr. Kurtam's practice.
So I actually grew up in the state of Maryland. I lived on the other side of the bridge near in PG County, and I went to all my schools in Maryland. I haven't come from a big family of doctors, and went to University of Maryland undergrad, Georgetown, GW for graduate and postgraduate in medical school, and then residency at George Washington. I ended up here on the Eastern Shore with my family. We take care of everything. We take care of brain surgeries, spine surgeries, peripheral nerve, carotid disease, a lot of diversity in our surgical practice. And we're fortunate to be here on the Eastern Shore. People here are very kind and nice. As far as students, love interacting with students. We have a lot of high school students that rotate through here. And if you guys are interested at all, just let us know and we'll get you through here. I've seen some high school students go to college and then medical school, and now they're actually full-blown doctors. So it really is a refreshing experience for me and rewarding at the same time. So anything I can do to motivate you in any way, it's one of the most fulfilling careers you can have, and you'll have so much gratification doing it.
We have our first question. It is, what is the greatest accomplishment that you two have had?
I don't know if we've accomplished much. It's hard to say a specific accomplishment. I think I would have to say our mission trips.
Mm-hmm. That's what I was thinking too.
Yeah, I mean, go ahead.
Can you describe that for the students?
Well, we've done 2 mission trips together with our neurosurgery team, which comprises some OR nurses, OR techs, and representatives with different companies to we went to Jordan and did a mission trip for the Syrian refugees there. They are throughout the city, but they're also in that big camp, if you guys know anything about the Syrian refugee camps that are there. So that was our first one, and that was like walking into the land of the Bible. And it was really interesting to see the culture, the food, the patients. Their expectations were not good. They expected to not be able to walk after surgery. They were just elated when, we kind of took our skill set of the minimally invasive and took it to the Middle East, and was able to pretty much do exactly or close to what we normally do here. And so the patients were really amazed. And that was really a special experience. And then our second mission trip, we went to Honduras. And one of the most memorable things about that was they don't have a lot, of course. None of these regions that need to have medical missions have much. But one lady, she brought tangerines, and they're known for their tangerines there. Absolutely the best tangerines I think we've ever had. And it was really a special moment to just really connect with people with from different cultures and assist them in their journey to health. And, you know, we hope we really changed their lives, and I really think that we did.
Yeah, I think you know, you dream all your life of doing something, and I'm lucky in that I'm living my dream every day. I've always thought about being a neurosurgeon as young as my son and my daughter are 5 years old. I wanted to be a neurosurgeon. So I'm literally going to work every day, living my dream. And to go and dream about going to another country and have your team with you and help people that are in need. That was something I'll take to my grave. So I hope that you guys find something in your life that motivates you, that you would do out of passion, and you can help others with, because I can tell you that is the goal.
The questions are coming in quickly now.
Yeah, I see. I have now learned how to use this thing. So that was Jordan, right? That asked the
Yes.
that asked the first question.
Yes.
And then Jordan asked another question. What does a nurse practitioner do? Everything. she does everything, and I just answered to her. I'm gonna summarize that. So
Yeah.
she sees all the patients with me. She has opinions about everything, and I follow them. She helps me in the operating room. It really is a very involved job, and it takes nursing to a whole new level, which is basically taking care of patients not only on the floors but in the clinics and in the operating room. So I'm going to go through some of these here. How many years of schooling? And that's Haley that asked that.
Mm-hmm.
Yeah. So Haley, I did schooling a little bit faster, but I'll tell you how long schooling takes to do what I do. So it's 4 years of college, and most people will do something after college to build up their resume, whether it's a master's or a PhD. Master's is usually 2 years, PhD is 4. And then medical school is 4 years. And then, you know, you got to be, 1, 2, or 3 in your class in medical school to apply to neurosurgery. And then plus the master's or a PhD gets you qualified to apply for residency. And residency is 1 year of internship and 6 years of residency. And then most residents end up doing 1 to 3 years of fellowship. So I think somewhere between 17 and 20 years.
Wow.
After high school. But don't let that deter you. If you're it actually is very enjoyable, and it goes by quickly.
Very fast. See, nurse practitioner, you can become a nurse. That most of the programs now are bachelor's degrees, so that would be 4 years. And then you practice for a while as a nurse, and then you can get your master's or your doctorate in nursing. It doesn't really matter right now. Probably by the time you guys get there, it'll be a doctorate program in nursing, and that would be 3 to 4 years.
And then you get to work and boss around the surgeon.
Yeah.
Who's been around?
Right.
Who's been around
Who's
schools
schooled all those years, but the nurses still dictate everything.
Listen, I promise you, whatever it is that you do that's worth doing will take time. Okay? But the time is worth it if you're passionate about it and you're doing something to help other people. It doesn't matter. I mean, forget about medicine. Anything else that's worth doing takes time and takes energy and takes effort. But you got to be passionate about it, because you'll enjoy every minute of it. If you're not passionate about it, it's going to be horrible. But if you're passionate about it and you're in love with it, it will go by. Every day will be a joy. I promise you, all these years, not one of them I disliked. Not one of them I felt stressed about. Not one of them I felt like, what am I doing? This is taking so long. I never felt that way. And I still don't feel that way now when I work hours and long hours, et cetera. It doesn't matter because you're passionate about it and you're helping other people. So that's my only advice. Don't, right now, these years look long for you because, you know, if you're 15 years old, to somebody to tell you that you're going to be in school for 20 years, that's more than your lifetime. But I promise you, I'm in my 40s now, and I look back and I'm like, I still have the rest of my life to work. So these years go by real quick, and it's not as long as you think it is in terms of your entire life. So do something that's worth it, no matter how long it takes. So let me see here. Accomplishments, the nurse practitioner, you already got that. Is it difficult being a surgeon who specializes in such an important and diverse part of the body? And that's Gracie that said that. Gracie asked that. Yes. No different than anything else. I'm not gonna overplay my job. You know, a lot of people that do highly specialized things overplay their job. You're trained to do it. It takes you that long to do it. So by the time you're done learning how to do it, it should be second nature to you. No different than anything else. That's why the training is long, so that when you're done with the training, it's not difficult. It's challenging. You want to be challenged in your life. You want to, no matter what you do, right? If you're a mechanic or race car driver or whatever it is, it's going to be challenging every day if you're a professional athlete. But it's not going to be difficult in a sense that you can't handle it, because that's the whole point of the training. Okay. Where do we work? In Easton. That's easy. Thank you for asking that, Jordan. What types of hours do you work? Fluctuates. Sometimes it's a 40-hour week. I don't know about 40, maybe a little bit longer than 40. But sometimes, you know, if you get caught like in a long case and you work overnight, it could be like last week. I had a stretch of almost 40 hours straight without sleep because we had a sick patient. I had to take care of the patient and all of that. So, but again, and none of it actually is hurtful to you because you know how to balance your life at that point. The days that you have off early, you enjoy it. The days that you're in late, you brace yourself for it and you're ready for it.
Yep.
What?
And for nurse practitioners, some people do have very regular hours. I chose to have a life that doesn't have as many regular hours, but you, like Dr. Kurtam said, you just learn to adapt, and you enjoy the time off, but you enjoy the time working too. So you just got to find that balance where you enjoy doing both areas.
I can tell you what that means for me. My balance, everybody has a different pie chart. So I would advise everyone here to develop a pie chart of what your life looks like. My pie chart has work in it, but it also has working out. I work out daily. It also has being a father. I'm a father daily. I'm not a part-time father. I'm a father daily. I take care of my kids the right way. I don't have sitters or nannies or anything like that. Friends, you make time to hang out with your friends. Team events, you know, your team, you have time for them. So everybody's family. I come from a family of 8 kids. I'm one of 8. 6 of us are doctors. So one of the questions here was, is it the same time to become a doctor? No, because I'm the only neurosurgeon in my family. Significantly less depending on what doctor you're at. Neurosurgery is the longest track. I would say about half of that for most other doctors. So, you know, you just make a pie, and everybody's life is different. So allocate whatever time that you need to allocate to feel whole in your life, to different parts of your life, but don't let one part overtake the others.
And that includes now too.
That includes absolutely in school. Like, you guys need to be working out every day. You need to be eating well. You need to be setting time for your friends. setting time to study, setting time to read outside of school. Like, you just can't just read your textbooks in school. Read something that interests you outside of that, right? When I was in high school, one of the things that I added to my pie chart was reading neurosurgery textbooks. I know that sounds geeky, but I did it. That's a little. I read 2 neurosurgery textbooks cover to cover in high school. So, everybody's different. Just figure out what your pie chart is and start it now, and be very organized even at this stage. Have a calendar, have a good way to be organized. You're already ahead of the game. We didn't have this when I was in high school, what you're doing now, which I admire you for. You're highly motivated, clearly. Just be very well organized and start your life right now. What else is here?
Is there a place that you would like to go but you haven't been yet?
Like professionally or personally?
Let's start with professionally.
Towers?
Well, I always feel like there should be some surgical needs in Belize or someplace like that. Wherever Carmen Sandiego would go is where I'd like to go also. We just haven't gone to an exotic area where we could also get some beach time. But, it's not ever about that, but it is kind of nice because we get to spend a little bit of time when we go on these trips to see the culture and to immerse ourselves a little bit. And it's treasure, it's treasure time. It's treasure time when you're taking care of the patients, and it's a treasure time learning about just everything about the culture that you went to go help. So, I think it would be kind of nice.
So as far as professionally, my God, the world, neurosurgery doesn't exist in a lot of places in the world. So there's a lot of need. There's a lot of places in this country that don't have neurosurgery. So professionally, you just close your eyes, get a globe, spin it, and put your finger on it, and that's probably a place that needs neurosurgery that you can go to. So that's a really large area to talk about. You can go anywhere. You can go in Europe and they have need. They can go to Russia, South America, anywhere in Midwest in this country.
I was thinking Indian reservation would be interesting.
Yeah, there is so many places professionally that you can go to help that don't have the services. As far as personally, I'm not a cold weather person, so I don't know about all the frozen places in the world, but a lot of the warmer places I would like to go to, like any beaches.
I want to go to Iceland because I'm cold.
That's right. I wouldn't tolerate the cold weather very well. So anything like the equator and down until you get to,
South Pole.
Yeah, the South Pole.
So one of the questions that came in from Jordan again was where you went to school. And I remember you saying you went to school in Maryland. What schools did you go to?
So I went to high school at High Point High School, which is in PG County. And if you ever look it up, it's not the greatest school, but that illustrates the point of it doesn't matter what school you go to, really. It matters what effort you put into it and what you make out of it. I took AP classes in high school that the school didn't have. I literally asked for the books, read the books on my own time, and took the AP exams in high school for classes that were never offered in high school. So High Point High School, and then I wanted to be close to my family, so I only applied to 2 schools. One is for shits and giggles that starts with an H that everybody loves. It's an Ivy League school, and I'm the University of Maryland for undergrad. And the University of Maryland was 7 minutes from my house, and I'm close to my family, so I ended up going to University of Maryland College Park for undergrad, and I did that in 2 years. And then I did a fellowship at NIH, and then I went to Georgetown University for my master's. I did that in a year. And then I went to GW, George Washington, for medical school, internship, and residency. And I did a fellowship at NIH in my residency as well. So all the schools in DC and Maryland.
Well, I went to Easton High School and graduated and went to McQueen Gibbs Willis, which was at the time part of the hospital. So there was a little dorm next to the hospital. So I lived on the campus. And then that was a diploma degree, and that was 3 years. And then I got my bachelor's degree at Wilmington University in Delaware. And then because of working, I went to an online program, Walden University, for my nurse practitioner master's degree.
Now there's a question here about biomedical as an AP class. So AP classes are advanced placement classes. They usually come with an exam that you can take as a national exam that based on how you score in that exam, it gives you college credits. So I don't know if that's an AP class or not, but it's easy to ask. You can just ask your counselor in school to see if it has an AP exam with it. The advanced placement is basically college level courses taken in high school, and based on your performance, you can get college credit. So out of high school, I took all the AP exams that can be offered in 1995, which is when I graduated, and I got 4s and 5s in all of them. So I walked into college with 70 AP credits. You need 120 to graduate college. I walked into college with 70 already. So just figure out what the AP classes are for your school, and if it's a class that interests you, take it. It's worth every penny because you'll end up saving money for college courses.
So we are coming close to the end of our time here. Does anybody have one last question before we go?
So for the people that were highly interested in this, I'm sure, I hope everybody else was, but Haley and Jordan, if you guys ever want to rotate through here or do some time or anything else that we can do for you, whatever we can do to motivate you in your career path, let us know and we're happy to help.
Very nice. This has been, do you love what you do, Jordan said. And I think you made that very clear that you absolutely love what you do.
I hope that was reflected in the way we talked about what we do.
Yep, absolutely.
I think if you can go 40 hours without sleep, you've got to love what you're doing. I'd like to thank you both for being with us today. You have a lot of great information to share with our students. Janine, thank you for organizing everything today. I'd like to thank all of our students for being with us today and asking the questions that you had. I hope you will come back and join us again tomorrow. Courtney, thank you for the applause. That looks really cute. And Claudia, thank you for joining us today as well. And until I see you again tomorrow, on behalf of Maryland Business Roundtable for Education, I'm Laurie Bell. I hope you all have a wonderful day.
Thank you for having us.
Thank you.
What's up? What do you need to do?
Oh, that was awesome.
No, I'm just kind of waiting till everyone's off.
Oh, okay. You guys are awesome.
They were. Everybody was.
Yeah.
Thank you, guys.
Thank you.